I forgot my name. Is that Anthony? Yeah, it's Anthony. Why would I make a YouTube channel with my name? Ew, that looks so gross and so real. I want to play it so bad. Playing Surgeon Simulator. I'm just kidding. Ingrown toenail removal surgery is the game. And let's start it. Okay, I'm gonna get scared and throw up probably. Oh, excuse me, that's my reflexes already. Start! I'm scared of this so bad.
Hello, and welcome to Surgery Squad's virtual ingrown toenail removal. I'm Dr. Jeff, and I'll be guiding you through this procedure today. An ingrown toenail happens when the edge of the toenail grows down and into the flesh of the toe. When this occurs, there is usually a moderate amount of pain, redness, and swelling around the toenail. An ingrown toenail is usually caused when extra pressure is applied to the toe due to shoes that are too tight or too loose, improperly trimmed toenails, foot or toe deformities, injuries, and fungal issues can also be contributing factors. There are some ways to treat an ingrown toenail at home to relieve some of the pain, but remember that you should never attempt to remove an ingrown toenail yourself. If you're a diabetic and have an ingrown toenail, it is recommended that you go to the doctor immediately. Now that you understand the causes of an ingrown toenail, let's put on our gloves and remove one.
Hang on.
Our patient is ready, so let's begin by disinfecting the toe. Now, we need to numb the toe with a local anesthetic. We'll have to inject the anesthetic in several locations around the toe.
Oh, that must hurt really badly. Right there. Oh, there's more blood there in there. Are you putting it in
Great.
mercury?
Now we'll wait a few minutes for the toe to get numb. Now that our patient's toe is numb, place the special tourniquet around the toe. This will help reduce the amount of blood coming from the wound. Once you've
Nailed it.
First, carefully slide one blade of the nail anvil under the affected nail. We're going to go down the nail until we feel a little bit of resistance. Our patient's going to feel some pressure as we cut away the ingrown nail. Great! Take the forceps and carefully remove the ingrown nail. It's getting kind of messy in there. Let's clean up that blood.
He sounds so calm. It's like he's done this 1 million.
See that small bit of pale yellow substance right there? It looks like the patient has a bit of infection in the toe. Firmly squeeze the edge of the toe.
Oh no. I'm sorry guys, this is gonna be over.
That toe is starting to look much better, but we're not done yet. Next, we're going to apply some phenyl acid to the wound. This will help in...
Okay, it says apply some acid into the wound. Phenyl acid.
When you're done inserting the acid, I'll remove the tourniquet and we'll finish up.
Go that deep.
Finish by applying some antibiotic ointment on a sterile gauze pad. Place it against the toe and wrap it in a gauze bandage. Fantastic job! Since there was some obvious infection, our patient will be sent home with a prescription for some antibiotics. We'll also need to tell our patient to keep the wound dry, clean the wound regularly, and replace the bandage 2 to 3 times a day. While our patient's toenail isn't likely to regrow, his condition is likely to return if he doesn't take care of his feet. This includes wearing proper fitting shoes, properly trimming his toenails, and keeping his feet clean and dry. And that's how we remove an ingrown toenail. You did a great job today. While you're here, try your hand at one of our other surgeries here at surgurysquad.com.
Which one do you want to see? I don't know. Okay, we're doing dental crown surgery.
Welcome to Surgery Squad's Virtual Dental Crown. I'm Dr. Jeff, and I'll be assisting you with this shaped cap that is used not only to restore the strength and functionality of a tooth, but can also improve its overall appearance. Before we begin, let's review the types of crowns used in dentistry. First up, temporary crowns. Temporary crowns are placed over a patient's tooth while they wait for their permanent crown. They're usually prefabricated and made of plastic or steel. A patient's permanent crown can be all metal, porcelain fused to metal, all porcelain, or all ceramic, each with their own advantages and disadvantages. Click on the different types of crowns to learn more about them. Tooth, courtesy of a freak softball accident. And we get the rewarding task of placing a crown in.
Metal ball.
If you haven't noticed already, it's one of their lower front teeth, tooth 23. Let's review what we're going to do today. To begin, we'll numb then shape it, take impressions for our dental lab, place a temporary crown, and determine the shade of the tooth. When our patient returns for their next appointment, we'll place their permanent crown. Now, let's put on our gloves and comfort the needle may cause.
Dude, you need a dentist.
Now we need to inject the local anesthetic. After it has taken effect, the area around the tooth and the patient's lower lip should be numb for a few hours.
And we have like 4 minutes.
Inject the local anesthetic into the patient's gums.
Oh, I remember when they had to do that to me.
Let's wait a few minutes to allow the anesthetic to set in.
5 minutes later.
Now that the area has become completely numb, we can move on to preparing the tooth.
Oh, I thought that was me.
To begin, we'll reduce the size of the tooth, cutting it away from the adjacent teeth. Go ahead, give it a try.
Oh no, you didn't let me. Yeah, I remember when they had to do that to me. So much to get out. It's taking too long.
It looks good, but we need to create a more tapered top to the tooth. This will allow for a more comfortable and exact fit for both the temporary and permanent crowns.
You know, why don't you shave the whole tooth off? Because it looks like that's what you're thinking. We have like 2 minutes left.
That'll do. Now that the tooth has been shaped, we'll need to take impressions of our patient's teeth. This is cement on the inside of the crown, so it's ready for you to place.
So sorry. Everybody chews with each. Everybody chews with each tooth. I'm not kidding.
Perfect. After the cement has hardened, the dentist would check the fit of the crown again and the patient's bite to ensure that there are no issues. Luckily for our patient, you did a marvelous job. After placing the permanent crown, our patient may notice some mild sensitivity for the first hour. Their dentist will also offer them some post-case recommendations to follow before they leave. This includes waiting at least an hour before having anything to eat or drink, and waiting 24 hours before enjoying their favorite sticky or chewy foods. If our patient has any pain or sensitivity when they bite down, they should contact their dentist immediately. This may indicate that the crown is too high on the tooth and needs to be adjusted. Most dental crowns last anywhere between 5 and 15 years, depending on normal wear and tear, oral hygiene habits, and other behaviors, such as teeth grinding, chewing ice, or biting your fingernails. Well, I hope you've enjoyed placing a dental crown. Maybe you should consider a career in dentistry. While you're at it, check out other great surgeries here at surgurysquad.com.
Well, I'm going to leave this episode here. Thank you guys so much for watching. If you liked it, yes, I went back a bit. Thank you guys so much for watching. If you liked it, please like, please drop a like, and please subscribe. Because I'm running low on subscribers. I have